We go now to our reporter, Lora Windsor, who visited Dr. David Morrow, and medical director of the Morrow Institute.
Roger, we sat down with Dr. David Morrow at his fully accredited facility in Rancho Mirage as he discussed the important first steps in choosing a plastic surgeon.
I developed something that I thought made some sense. The 5 W's that I think any person should consider when they're thinking about having plastic surgery. I'll preface this by, this is real surgery. This is real surgery. And I tell patients that cosmetic surgery is really for someone who thinks like an adult. Has its upsides and has its downsides. And after surgery, you have to live with those upsides and downsides. There's no perfect world, and there's no guarantees. So you really better do your homework up front and be confident and comfortable in the 5 W's. Very briefly, the 5 W's are who, what, where, when, and why. Who should do your surgery? You really need to find out who this person is. Are they board certified? You need to log on to the California Medical Board website and see, have they been disciplined? Have they lost their license? Do they have reprimands? You need to be sure of their background. And do you think that they have the integrity to be able to do what they say they're going to do?
Dr. Morrow continues with the 5 W's.
Next comes what? What are you going to have done? You should have a very frank and open conversation with your surgeon that they can explain to you what they propose and why. In layman's terms, that you should totally understand, because this is not magic, thank God. It's physics. It's movement of tissue. And thank God there is no magic. It's got to make sense. And if they can't explain it in a manner that makes sense, don't get done by them. If you're having facial surgery, don't go to someone who specializes in doing body surgery. Make sure that you get done and have those procedures done by those who specialize in that type of surgery.
According to Dr. Morrow, the surgical facilities must meet high standards.
Then comes where. Outpatient surgery centers are outstandingly helpful and cost-effective. However, they too are on a bell-shaped curve, from those that are minimal standard passing to those like ours that really are outstanding excellence and basically qualify as outstanding small hospitals. So there too, look and see. You should actually see their facility, see the operating rooms, see the post-op rooms. It shouldn't be just a little part of a doctor's office. It should be a veritable freestanding surgery center that if, God forbid, something happens, they have everything there that they can handle and know how to handle that problem. When to have surgery is when you have a problem that you don't like and you have the health and the wealth and the mindset to fix it. Then comes why. You have it done because you have, thank God, the health, the wealth, and the luxury of giving yourself and everybody who sees you a gift of art. It's lovely to look at someone who's lovely and or handsome. So that is the gift that you give yourself and everyone who sees you.
Evaluating and choosing a plastic surgeon to perform any kind of elective surgery is one of the most crucial steps after deciding on a facelift. Consider carefully. For the American Health Journal, I'm Lora Windsor.